Okay, this is Nancy, Hospice Care Queen. We've got to talk about vomiting. And vomiting, which is also known as emesis, is the forceful expulsion of stomach contents through the mouth. Sometimes it is preceded by nausea, but sometimes not. So what to do? First, do not try to stop the vomiting. Allow it to finish. Have that bowl or basin at hand if it's been a problem, a repetitive problem. If this is the first episode, then move through these steps. Do not give anything to eat or drink for at least 30 minutes. And then give 1 tablespoon of any clear liquid that the patient likes and wait 30 minutes. If okay with that, then you can give 3 tablespoons and again, wait 15 to 30 minutes. If the patient's okay, then you can allow slow sipping of fluids as the patient desires. If the nausea and vomiting returns or the patient hasn't tolerated even the small amount of fluids as described, provide that PRN medication your hospice team has prescribed, like we talked about in video 2, either sublingual, oral, or rectal, Haldol, lorazepam, whatever you need, Compazine. Of course, call hospice if you're unsure what to do or what medication to give, or if nothing you have done has helped relieve the symptoms. When nausea and vomiting have been a problem for your patient, try to come up with a regimen for prevention. If they complain of nausea or vomiting when they first wake up in the morning, suggest eating some crackers before even getting out of bed. Or eat a high-protein snack such as a lean meat or cheese before going to bed if they can tolerate it. Drink fluids actually between meals rather than with the meal. And why? Because the fluids dilute the digestive juices and it takes longer for the stomach to empty. Try to eat when you feel less nauseated, of course, and of course keep those bowels regular. Have the patient eat smaller, more frequent meals, and do eat a small amount of food before taking medications. Make sure they sit upright, and if possible, for an hour after eating to prevent esophageal reflux. As always, try to figure out what has caused it and stop that food or lifestyle if you recognize a pattern. Consider scheduling an antiemetic medication 30 minutes prior to the usual occurrence. Of course, do try to get on top of the symptom as quickly as possible since it may contribute to dehydration and an acceleration of the patient's decline towards death. Thanks for watching this series of videos on nausea and vomiting. Please use our booklet, specifically pages 18 to 19, and write in your specific instructions that work for you to relieve nausea and vomiting. We want you to be comfortable at all times. Brenda and I are here to help. Visit us at thehospicecareplan.com and watch more videos at our YouTube channel.